Is there an actual way to test for sensory issues? Hi, my name's Callie. I'm a pediatric OT, and this falls right into what I do all the time. Number one, you're going to want to work with an occupational therapist because, as an occupational therapist, we are trained in anatomy, neurology, kinesiology. We're very, very well versed with the human body, and we go through training that involves different sensory techniques. So I had a lab where they taught us how to use sensory items, and then I also had a clinical where I had another experienced OT teach me how to use sensory items. So if you're going to anyone, it should be an OT. Speech and PT kind of know about it, but they're going to probably refer you to an OT. As an occupational therapist, we do clinical observations, which I'll talk about, but we also use testing tools in order to kind of pinpoint, number one, if there's a sensory issue, and number two, what area it could be in. So my favorite tool to use is called the Sensory Profile. It comes in a variety of questionnaires. There's a child one for a caregiver, there's a school one, there's a toddler one, there's an infant one. There might be one for adults. I've never used it, but it does a really great job of collecting the data that we need to really look at sensory. So what they're questionnaires for a caregiver or a teacher to answer about their child. I'm going to give you an example. In the child questionnaire, our first question is, my child reacts strongly to unexpected or loud noises, such as sirens, dog barking, hair dryer, and then you would rate it 0 to 5. So does not apply, almost never, occasionally, half the time, frequently, or almost always. This is something that an occupational therapist can score. The manual for it also gives a lot of good techniques that OTs can use. And then if you're working with an OT, they're going to do clinical observations. So they're going to look at things like some signs of sensory differences, toe walking, touching a lot of items. Stimming can be a sign that a child has sensory processing needs. We don't stop stimming, but it can be a sign. So if they're shaking things, fidgeting, an eye gaze, so like looking out the side of your eyes, being sensitive to noises. As an OT, we really get to the bottom of what is going on, and then we know all the tools to help. Comment below your best sensory question and follow me for more OT content.